Hello everyone, welcome to yet another episode of CIO Podcast. Today we have with us Mr. Surjeet Thakur, who is an experienced Chief Information Officer with over 24 years in healthcare IT. He has an impressive track record in designing, leading and managing healthcare solutions across Middle Eastern and Indian healthcare industry. Currently, he is CIO of Rajagiri Hospital, Kochi, as well as he is the founder and CEO of TrioTree Systems. In his career spanning over 2 decades, he has worked with top healthcare and IT organizations, including Dell and Max Healthcare and American Hospital, Dubai. Now, his expertise spans across healthcare IT consultancy, HIS and EHR development, implementation, and planning. He brings a wealth of knowledge to the table. So join me in welcoming him to CIO Podcast. And today we are going to discuss about the importance of adopting new technologies for hospitals and the challenges and threats for that. Welcome, sir. Welcome to DHA.
Thank you. Thanks, Aarti, for having me.
Well, sir, let's get to the elephant in the room, technology adoption. While healthcare is one of the key areas where innovation keeps happening, it is pretty slow to adopt digitization of processes, especially in India. While hospitals are using EMR softwares in one form or the other, a fully paperless hospital is still a pipe dream. What would you say, why is adopting tech important for hospital?
So if you look at the entire paradigm of healthcare and the entire evolution of healthcare, initially it used to be more focused on the patient care. So people used to go to the hospitals on episode basis because there are a lot of family physicians which you get treated on, and if there are any other complication, then you used to go to the hospital. So which was actually known as episodic care. Then the evolution happened to quality of care. So patients demands as it is that if I'm paying this much, then there has to be a quality. Now we have moved even beyond that. So now it's more of patient experience as well. I mean, I'm going to the hospital, I'm paying for it, or my insurance is paying for it. Indirectly, I'm paying for it. I mean, I deserve all the services. So there is a sort of a pressure also from the patient side to have the same kind of experience what he's getting while using his app for ordering food or ordering tickets, or same experience is what they would want because they're paying for it. Primarily, largely it's coming to that. And on the other side, the hospitals also, and hospitals make money not from the new patients. They actually make more money from the repeat patient. And let's accept that they're also in the business of making money. They are, until you are a fully charitable hospital, largely the corporate hospitals are there for money. So, I mean, what should they do apart from the regular hospital healthcare operations to attract patients is the usage of technology. So I don't think, so there is a push as well as pull methodology from both patients as well as hospitals to ensure that usage of technology is there because it helps in scalability. These things have changed post-COVID because the earlier challenges was the hospital, even though they wanted to adopt technology, but when it came to the doctors, they had a lot of resistance. But COVID had actually taught even the doctors that you'll have to adopt to technology there because that's where the world is moving towards. So that is also the reason that there is a lot of focus back on technology adoption. So one side is the patient, other side is the doctors or the clinicals. And the third side, of course, is a lot of corporates coming in. They do a lot of data churning, data analytics. That is humanly impossible to do it manually. So all hospitals, generally, they call it as a flash report or a daily report, which will go to the CXOs every day morning. Now, what should we do to automate? What should we do to make it more efficient? Can we do to make it less error prone? Because if humans are doing it and they're spending 1 hour, there are challenges. So that is where the focus is. So primarily, if you look at the entire paradigm, 3 key stakeholders: hospitals, when I say hospitals, operations or the clinicians, other is the patients, and third is, of course, the management, which wants more data. plus the fourth would be the regulators. So regulators primarily in India, when I say regulators, is primarily the NABH and JCIA. If the hospitals are accredited to those, you have to manage those KPIs for reaccreditation, which would become difficult if you're trying to do it manually. And then there's a lot of data mismatches that happen if you want to do it manually. So these are the key focuses why a hospital has to adopt the technology now. To what extent is, of course, it depends on the cost factor. It depends on digital maturity also. But there is absolutely no denying to the fact that they can't shy away from technology at all.
No, absolutely. And you mentioned about the cost factor. Actually, my next question is about the cost factor. In fact, whenever we talk to CIOs or we talk to hospital, executives, they talk about cost factor as one of the major barriers for the technology adoption. But I want to go beyond that. What, apart from the cost factor, which is now very much an established fact that this is a barrier for the technology adoption for healthcare organizations, beyond that, what are the other barriers for technological adoptions in healthcare systems?
Yeah. So, you rightly said cost is a factor. So, if the hospital perspective, the challenges that they have, and I'm not saying there are no solution to those challenges, but general apprehension of the challenges that they have is the lack of infrastructure. And lack of infrastructure not necessarily means that you'll have to give iPads to all doctors if you want to do a clinical adoption. It could be as basic as having a Wi-Fi, having internet connectivity. Is the internet connectivity reliable enough or not? If you want to do a telemedicine where the patient is outside, you have to rely on internet because the video streaming has to happen. If the internet is not good enough, so all of these comes under the ambit of the infrastructure. The devices itself. If you don't give a device to the doctors or the nurses and you want the data to be captured onto the patient bedside, it is not possible to have a PC put in all the patient rooms. So one is, of course, the infrastructure in that terms. And the second infrastructure also, what I say is, if we consider human resources or human capital, then that infrastructure is also problematic in India. The digital literacy or the digital divide, the basic digital skills also is a challenge. So that also I want to club into infrastructure. The second issue is the privacy concerns. A lot of hospitals and doctors have a concern that what happens if there is a data breach. So there is a sort of a lack of trust in how the data is collected, how it is stored, and how it is being used by the tech company. So, and then once you are capturing, the other concern is the security breach.
Right.
So like we all know, so in November 2022, 𝐴IMS had a cyber attack.
Yes.
So those are the concerns. Again, once you have an apprehension and you're not sure of what the solution is, those become an impediment for your technology adoption. One of the challenges in India, even you look at the regulations, JCIA or NABH, they're not regulators. They are statutory bodies which give you a certification and they'll tell you this is what you need to capture and I would need a KPI based on this. How you're doing it, they're least bothered. And what that essentially does is there's a very inconsistent data formats and standards that happens. Because then it is left up to everyone's interpretation of how you have to do it, which leads to fragmented ecosystem. So lack of standardization and interoperability is the third concern. Fourth is the regulatory framework. In India, the regulatory framework as far as health is concerned, now with the ABDM, which was earlier NDHM, the ABDM, things seems to be there seems to be a clarity in terms of what the government is trying to do. So the regulatory framework also needs to adopt, and they often struggle to keep pace with the rapid advancement in the digital health technologies. I mean, the best example is again COVID. in COVID, when the COVID happened, the telemedicine regulations, there was a need to have a regulation, telemedicine regulation. What will happen when you are trying to take a teleconsultation for a remote patient whom you have not even met?
Hmm.
How will you ensure that he's the right patient and he's not doing an impersonification and all? So the government actually came up with a modified teleconsultation and telemedicine regulation because there is a need. That thing, government needs to be slightly more agile to ensure
Hmm.
that they keep pace with the advancement of rapidly evolving technologies, and also in terms of data governance and compliances, which we think that is changing with ABDM.
Right, right. So you mentioned about digital literacy. I wanted to know, when it comes to digital literacy, do you mean only the patient side or also the doctors and clinicians side?
Oh, both sides, and not necessarily doctors and clinicians. It could be even nurses.
Hmm.
Let's agree. I mean, in India, and I'm primarily talking about India.
Hmm.
In India, it's a diverse country. Even though the nurses come from a varied background, expecting them to be an expert in computers, which is not the case. So, a lot of places where and language is also a barrier. They might be proficient in their local languages, but then lot of these technologies are in English.
Hmm.
Uh, so those are also the digital challenges that we as a country face, and lot of places where there is an push from the management to adopt to technology, whether it's HIS, EHR, EMR. One of the
Right.
things that we have to run parallelly is the basic computer literacy.
Correct.
At times they don't even know how to switch on the PC. So that's also a fact. So and I mean, lot of times we get a call either from at TrioTree, or at times from the hospital. Also, the hospital IT will receive a call from nursing saying that my system is not working, and when we actually
Hmm.
go there, you realize that the power cable was just not. I mean,
Right.
it was slightly flanky there.
Correct.
So
But sir, isn't it like a paradox? Because most of these doctors, and why doctors, even everyone we have seen in India, they are using mobile phones. They are seamlessly using all the apps and everything. But when it comes to this particular aspect, it is slightly difficult.
yeah, so I mean, the way we call this primarily a behavioral change that we'll have to bring. Uh, so let's admit also a fact that lot of these clinicians, and we hear this word from them, that I've been practicing medicine for the last 40 years. This is how I have done it. Now you are asking me to change. And then that's a fact. That's how they have been practicing medicine, with using paper, pen, and a while in the IP, they wanted a file. Everything was clubbed in the way they wanted. So it was all bookmarked. They can directly go there. With the technology, you can't do that. Everything has to fit into that phone, or iPad, or a tablet, or a laptop. So, but things have changed now. A lot of the newer generation doctors, they are doing thesis in the laptop itself. They're doing it on they don't have these challenges. Similarly, these technologies now, almost all the elderly doctors use WhatsApp. Few of them started using voice to text. So, I mean, I would not say this as a paradox, but what I would say is, India is a varied country. You have doctors who are aged 60, 65, 70 as well. Vis-a-vis, there are few doctors who are in 30s. So,
Hmm.
and you have to give a solution to both. So that is a challenge that we are in the phase of evolution in terms of healthcare technology. And I have been in US. We have worked in Middle East. We have seen Africa. We're doing a lot of work in Africa, in lot of areas in Middle East, whether Bahrain, uh, Oman, Kuwait, Dubai. I can tell you
Hmm.
with conviction, and that in India, I'm not talking about the potential. Generally, the adoption levels is far greater as compared to the other geographies.
That's an interesting aspect, sir, because my next question was regarding that. You have worked in healthcare systems in Middle East, you have worked in US. So given the fact that Middle East looks at the West and adopts best practices from there, what exactly is the key difference that you noted between healthcare IT landscape in Middle East, US, and India?
Okay. So one of the major challenge is, of course, so they look up to West, they adopt technology, they don't have a concern of money. By and large, I mean, no one wants to spurge money, but at least from a technology perspective, they'll not say, I mean, let's measure whether we want to give laptops to the doctors or not. That's not a concern. Uh, but in India, the thing is, I mean, look at the economy of scale in India. The adoption in one hospital would be far more, but because there are so many other hospitals where the adoption is low, the general perception is that no, I mean, that healthcare has not evolved there, and then that's also a fact. But if you consider one to one, if you take one hospital here vis-a-vis one hospital in Middle East, the adoption would be much better in India as compared to theirs. Even though and with the lesser resources and lesser infrastructure, with not so adequate infrastructure, uh, I mean, we have done phenomenally well. But then we have done phenomenally well in pockets. And in India, we have to cover long dimensions across east, west, north, south. So that is the only challenge that I see is that money is what helps them drive, and also regulations. If I take an example of Dubai, but I mean, Dubai might not be exact apple to apple comparison, because one Dubai would be one fourth of Delhi. Uh, so regulations there, actually, even though it's easy, but they have made regulations saying that this is what you have to do and there is no choice. In India, it's a democratic setup. Health is a state subject. So a lot of times these regulations is it's not so easy to adopt in India because of the kind of country we are in. But otherwise, I don't see any challenge at all. And also because, again, like I said, when I said infrastructure, I also mentioned resources. Anyone who goes to Middle East, for example, knows that, I mean, English, that's given. You have to operate in English. That might not be the case if you are trying to implement in one hospital, which is maybe 160 kilometers beyond Bangalore. Bangalore is a metropolitan, but if you go beyond Bangalore 60 is Shivmoga. We have got 3-4 clients in Shivmoga, and there are a lot of challenges. They only speak, largely the nurses, they only speak in their local language, which is Kannada. Which you will not have these problems if you go to the other parts of countries.
So because of the diversity in India, you face a lot of, barriers in terms of cultural barriers, language barrier, etc.
True, absolutely. And that is the only barrier. And also the economy of scale. Total number of hospitals in India, if we talk about nursing homes and private, public, could be into 100,000s. Vis-a-vis, if you talk about UAE, the total numbers could be in hundreds.
Okay.
So let's look at the comparison also cannot be done because the scale is totally different.
Absolutely. Agreed. So one more question regarding this. You have led implementation healthcare IT projects across your career. Can you share any lessons as to the best practices from technology implementation projects that you have led?
Okay. First thing first, the project sponsor has to be onboarded onto this project. Democracy is good, but democracy at times becomes an impediment to the implementation also. So the project sponsor, once he is onboarded on the project and his patronage is there and he says this has to get it done, come what may, in this time. That sets the tone for the implementation. Because largely, and all these challenges that we spoke about, technology, one of the concerns that the doctors have, that if I'm using technology, my connect with the patient goes. That's a fact. But then you have to take both sides of the story. And we have to find a solution that while you are saying this is correct, but you still have to use it. So why don't you use voice to text, which will reduce your work? Why can't we have a physician assistant that you still do what you're doing? The physician assistant enters the data into the system. So usage of technology, people, and some optimization of process, that before the patient walks in, if you can capture a lot of data like history of the patient, allergies, vitals, even before comes, that reduces the time, and then you can spend some time. So so this goes to the same point is onboarding of the project sponsor and the patronage of the management, that this project is not an IT project. This is a hospital project, and we have to get this done. That is my biggest learning. And there have been places where, before the finalization of the software, the senior management spends a lot of time. Post implementation, they think this operations is business as usual. It will take some time, leave it. The moment you do it, the focus is lost. Once the CEO or the chief medical director, the CFO, those CXOs are also onboarded. They also come into the meeting. The general perception in the people is, this is a project. It's better that we adhere to what they're asking for. It's not that there will not be discussions. It's not that it will be bulldozing and getting things done. But at least the entire discussion would be around how do we make it work. And second would be data standardization. You cannot, and process standardization. You cannot have, you tell me the person, I'll tell you the policy. There has to be a standard. And because healthcare doesn't work in isolation, pharmacy cannot say, I will have this rule, and the supply chain says, I'll have a different rule, and lab says, I have a different rule. It's an interdisciplinary and interdepartmental actions that will have the complete patient process. The patient has to go through all of these. But if you look at patient journey, these are all departments are only actors. So data standards and process standards actually helps, and it makes the thing efficient. Hospitals are always, and it will always happen, they keep battling with people leaving their organizations. And this is not only for nurses, across the departments. So that people leaving the organization, if you have standard processes, if you have standardized data, then the implementation will become easier. So primarily these three things is what I'll say. Patronage from the management, data standardization, process standardization.
Well, another issue that most healthcare organizations also face when we talk to CIOs, they say that most of the healthcare organizations who are working with legacy systems and now they want to try out some new technologies, the integration or the transition becomes very difficult. So according to you, how do you manage the transition or integration between the legacy systems and the new age softwares?
Yeah, that will always remain a challenge. And also the challenge is not only a technology challenge, but it's also a behavioral challenge. Let's admit to a fact that if we go and tell a vendor that we did not find you good enough, and now we are replacing you with someone else, there's some sort of a resistance that comes to the vendor from the vendor side. Because when the incumbent vendor feels that, what is in it for me now? Anyways, I've lost this client. So that resistance comes. Second, from the hospital also thinks that, okay, why do, anyways, these guys are going, why do I need to pay them? So, that we'll have to protect the interest of both parties. That generally hospitals don't do for their own obvious reasons. And then, of course, the challenge is in technology itself. We are trying to make, or for example, a data migration from a legacy system to the new system. The technologies are different. The data which is stored are different. And hospitals say that we are into project implementation. We are not running a data migration project where the data migration cost itself would be 3 to 4 times the cost of the implementation or the product itself. So, that challenge, I don't see this going unless until, and that's where the regulation comes into play, unless until we have ABDM, something like ABDM in practice, where we are saying you don't need to migrate because all this data, anyways, in some standard format which ABDM has given, you have already uploaded this into the DigiLocker, into the Aadhaar number, which is a standard. So each software has to comply to that standard of data accumulation and then updating into the DigiLocker. So post that, this might become an easier. Till that time it doesn't happen. This challenge, I think these CIOs will have to struggle with.
Another challenge that most of the people highlight in the industry is the problem of interoperability.
Yes.
We are talking about that healthcare could have a next UPI moment, and we are still debating about interoperability today. Why do you think that interoperability is such a big issue, and what could be the way forward?
Okay. Interoperative, because so in healthcare there are two things, because there are so many departments that we are trying to integrate in a hospital. And just to give you a perspective, generally for a multi-specialty hospital, there would be almost 40 different departments, few back office, few front office, and then few would be the clinical departments. You have to automate all of those, and all of those needs to seamlessly talk to each other. So in order to do that, you cannot shy away from the fact that these departments need to talk to each other in the most efficient manner, and they have to talk in the common language.
Okay.
But because these departments, you cannot have one software which might solve all the purpose, and it might be best in all the departments. So generally in healthcare, either you go for best of the breed or you go for a comprehensive solution. For example, for radiology, you might go for a separate product from RIS. For lab, you might go for separate LIS. For blood bank, you might go for a different product. And then all of these need to talk to each other, because ultimately you are still serving one patient, irrespective of the various softwares that you might have. So interoperability is required primarily there where you have different softwares running and you have gone for best of breed. And I think that is the way. That's a decision that the hospital has taken, and it has to be for the data transfer has to be seamless between all these applications, and the information share has to be seamless. They should be able to communicate easily, and it cannot work in a fragmented ecosystem. The moment it starts working in a fragmented ecosystem, you have manual interventions. Now it happens separately in billing. If you are using a fragmented lab solution, someone will have to punch in data because it cannot be seamless. And the moment that becomes error prone, the system becomes inefficient because it becomes human dependent. Someone will have to type in, it takes a lot of time, otherwise it can be quick. So interoperability is a key for the adoption of technology and also to give the right results.
Absolutely. I agree with you there. My next question is about the capital that is required for the digital transformation into healthcare systems. Now, as you rightly said, you have to integrate all these technology in your healthcare organization. You need A, willingness, and B, you need a capital investment. But even today, most of these hospitals still don't have a defined IT budget. Why do you think it is so?
I think that the reason could be, if you look at India, healthcare is a basic need, right? But what is the budget allocated to healthcare? So it actually it comes from top. It comes from top. If we look at and in our daily lives, healthcare is a must. But how many of us actually have taken healthcare insurance? So similar thing happens to technology. We want to adopt technology, but we don't want to invest money to get the kind of outcome and that's where we do compromises. So I mean, primarily for private hospitals, they see IT as a back office function, primarily as a cost center, because you're not getting any tangible return out of it. All the returns that you get is intangible. And the moment it becomes, so it's a cost versus value. The moment it's cost, it's very definite. The moment it becomes value, it's very intangible. And the moment it becomes intangible, but it depends on my perception as to what I look at the value vis-a-vis what your perception of the value. So that one of the things that we are, for a technology adoption, what is also important is to shed this mindset of IT being a back office operations. It is not a back office function. It's not a support function. It is a strategy function. So you do a marketing as a strategy because you have returns. It will entail more patients. Similarly, IT also has to be looked into. The only difference is in this, you will get more intrinsic and intangible value as compared to direct costs. Of course, there will be a cost saving. Absolutely no doubt about it. But that is not the only benefit that you get as an ROI for an IT adoption.
So only the tangible ROI aspect of it, takes precedence over the other values that digital transformation brings into the healthcare system.
True. So a hospital, either they would want to enhance their revenues. Where there is no scope of enhancing revenue, they would want to sort of lower their costs. So the challenge is from both sides. At times, we as a technology people are unable to explain that to the senior management of the hospital, the CFOs and the medical directors and the CEOs as to what is the benefit. And at times the challenge is also other side. The other side is also at times they also don't understand. They don't comprehend the benefit that the IT will bring onto the table. So it's always chicken and egg, but things are changing now because with regulations, like I said, with regulations, it is either becoming a norm, and also there's a push from the patients that, I mean, I need kiosk. Why should I come in this queue? I've already taken the appointment. Why can't I do a payment online? If I've done the payment online, why do I need to come and stand in the queue? Why can't I have a kiosk to check in? So these push also is actually leading to that, but primarily with no direct tangible benefit is one of the bottlenecks, or rather lack of understanding of that is what is leading to lower adoption here.
No, it's sort of interesting because when you talk about patient behavior changing, they want the same kind of facilities that they get anywhere else while using their food ordering apps or other sort of apps. They want the same experience into their healthcare systems, the healthcare systems they go to. So is patient behavior getting the healthcare organizations to think that, oh, we need to do this and we need to take a concrete decision on digital transformation? And what exactly are the patient, expectations? What patient expectations have you encountered?
So gone are the days, and I'm saying this with utmost respect for the doctors, but generally gone are the days where in patients' mind, doctors were gods. That perception has changed now. And that is the reason, if you see the lot of litigation that happens, which was not the case 20 years back, because we thought doctors are a form of God. They can do no wrong. But with this in change perception, and I'm not saying it's 100% change or not, but that's also a fact that the patient also feel that I can question. Number one, with the pay, I as a patient, the entire paraphernalia, I have Google with me, so I think whatever doctor has written the prescription, I can put this in the Google and I can see whether the doctor has actually done the same thing or not, because Google knows everything. It knows more than you about you. So, I mean, that is one of the things that has changed. And patient's expectation is, I'm paying, so I deserve this. You're not doing to me this as a favor. Second is, if I am coming to you, I'm a customer. Because I'm paying, you are surviving, and I've got other options as well. And again, I mean, when the hospital does marketing, this marketing also at times has given the patient that privilege that I'm important. See, these people are calling me. And that is the reason that perception has changed. And their expectations are skyrocket. They might not say still in front of the clinicians or the doctors, but for other, I mean, they if I go to a hotel and Wi-Fi is a norm, I mean, I don't have to ask anyone. Similarly, if you're charging me of almost the hotel rate for the hospital suite, why should I even ask for Wi-Fi? It's given that you will give me Wi-Fi. So, I mean, these are all implicit because of the entire paraphernalia that I'm addressed. If I can do the same thing for my movie ticket, I've paid online and I just scan the QR code and go inside. I don't go to your counter for a paper ticket. Why should I do the same for my hospital consultation appointment? Because I paid online. So I think the entire paraphernalia also is pushing the patient for higher expectation. And to be fair to them, that's also one of the important reasons why the hospital also wants to adopt technology. Because if that is not the case, I still feel if hospital given a choice, they would still want to be laggards. But the patients are really pushing hard. Their expectations are pushing the hospital to adopt newer technologies.
Well, let me come to my last question. What are your future plans for digital transformation at your organization as a CIO? And you have been on both the side of the things. You have been at TrioTree, you have been a CEO of TrioTree Systems, and you are also a CIO of a healthcare system. So tell me, from digital transformation perspective, what are your future plans?
Okay. So, Rajagiri Hospital is a JCI accredited hospital, multiple hospitals running on a central application. It has almost close to 3,000 OPDs in a day, and all the doctors are seamlessly using the system. Even in IPD, doctors are using the system for orders, CPOE, what we call as nurses. The entire documentation is happening in the system. Now our next focus is primarily on the medication administration. We want to make it as a barcoded medication administration on the patient bedside, so that all the 5 rights, right patient, right drug, right time, right dose, right, I'm forgetting the one right. So that also is, the system should be able to do that. That is our immediate plan. And secondly, we from a patient engagement perspective, there's a lot of things that we are doing, setting up kiosks, Pathfinder, because bigger the hospital, it's difficult for patient to find a place. And you can't be putting people all across to do that. And one of the things that we are also parallelly working in a hospital is to putting a command center. So command center is now with all these disparate IoT devices, whether it is in ICU or a non-ICU or a post-op or a pre-op or even in OPD. So you have all these fragmented devices who's pulling data seamlessly. Now you need people to look at that data on a real time and analyze. Otherwise, this data becomes junk. So we are setting up a command center where all these would be actually be consolidated, put on a system where you can look at it, and it would be manned 24/7. So the idea is that it's not retrospective, but it's proactive. Proactively, people are looking at it and ensuring that the any flagging of abnormal vitals are addressed, and people would be look at it. From a TrioTree perspective, we are looking at more avenues of it and of technology inbuilt in the system to make it easier for the clinicians as far as possible, because they are at the central fulcrum. On one side, if it is a patient, the other side has to be a doctor. What nurses do, it comes from the doctors. What the department like pharmacy, lab, or radiology does, it is actually from the department. What can be done to make their life easier and they don't see technology as a burden for them? Because there are two things. One is making them use the system, and then making them use the system efficiently. If you push them hard that you have to place the order, they'll only place the order just to sort of do a tick on the checkbox. But if we want them to do as much data capture as possible, which they genuinely want to do from a completeness perspective, because then only you can do a data churning and data analytics on top of it. You have to make technology more seamless and efficient for them. So those are the two things that we are working on.
Absolutely. That sounds wonderful. And thank you so much for this conversation. This has been a very enriching conversation for me personally as well. And all the best for all the plans and strategies that you have. Thank you so much for joining us on this conversation.
Thank you, Aarti. Thanks. It has been a pleasure. Thank you very much.
Thank you. And for all those who are watching this, please share your views in the comment box below and do not forget to like and share this video. Thank you so much.